In this video, we are going to discuss error prevention and deviation handling in laboratories. In laboratory operations, even small mistakes can affect data accuracy, product quality, safety, and compliance. Therefore, laboratories must follow proper systems to prevent errors and handle deviations effectively. In this session, we will learn about laboratory errors, deviation management, root cause analysis, CAPA, and GLP compliance. By the end of this session, you will be able to understand laboratory errors and deviations. We will identify common causes of laboratory mistakes and discuss deviation handling procedures. We will also understand corrective and preventive actions, commonly called CAPA, and the importance of error prevention under GLP compliance. Laboratory errors are unintended mistakes that may affect different laboratory operations. Errors can impact experimental procedures, sample quality, data accuracy, equipment performance, and regularity complaints. Even very small errors can affect scientific reliability and laboratory credibility. Therefore, laboratories must focus strongly on error prevention systems. Error prevention is extremely important in laboratories because it improves data accuracy and reduces operational risk. It helps maintain laboratory quality and improves workplace safety. Proper error prevention also prevents financial losses and regularity issues. Preventing errors is always more effective and less costly than correcting them later. Laboratory errors are classified into different categories. Human errors include incorrect measurements, poor documentation, and failure to follow SOPs. Equipment errors include instrument malfunction and calibration problems. Environmental errors may occur due to contamination or improper storage conditions. Procedural errors are occurred when laboratory personnel deviate from standard procedures. Laboratory errors may occur due to several reasons such as lack of training, poor communication, inadequate supervision, excessive workload, improper equipment handling, and failure to follow SOPs are major causes of errors. Understanding the root causes helps laboratories to prevent repeated mistakes. A deviation is any departure from approved SOPs, standard procedures, expected laboratory conditions, or quality requirement. Deviations may affect laboratory quality, safety, reliability, and data integrity. Therefore, all deviations must be identified, documented, and investigated properly. Deviations are generally classified into three categories. Planned deviations are approved temporary changes to procedures. Unplanned deviations are unexpected events or procedural failures. Critical deviations directly affect product quality, laboratory safety, or data integrity and therefore require immediate attention. When a deviation occurs, the issue should be first identified properly. Supervisors must be informed immediately. The deviation should be documented accurately and its impact and risk should be assessed. Corrective actions should then be initiated. Prompt reporting helps minimize operational impact and prevent further issues. Root cause analysis, commonly called RCA, helps identify why a deviation occurred and what contributing factors were involved. It also helps identify weaknesses in laboratory processes. Common RCA tools include 5 why analysis, fishbone diagram, and process mapping. Identifying the true root cause helps prevent the same problem. CAPA stands for Corrective and Preventive Actions. Corrective action refers to actions taken to solve an existing problem. Preventive action refers to actions taken to prevent future occurrence. Examples include staff retraining, SOP revision, equipment maintenance, and process improvement. CAPA systems help improve laboratory quality management. Important error prevention strategies include strictly following SOPs, regular staff training, and proper equipment calibration. Accurate documentation and double checking critical procedures are also essential. Maintaining organized laboratory workspaces reduces operational variability and improves efficiency. Proper documentation plays a very important role in deviation handling and quality systems. Documentation helps maintain traceability, supports investigations, records corrective actions, and improves accountability. Accurate documentation is essential for effective deviation management and regularity compliance. Laboratory personnel play a major role in preventing errors. Staff should follow approved procedures, report issues immediately, maintain discipline and accuracy, and participate in training programs. Personnel should also support quality improvement activities. Awareness and responsibility among employees help reduce laboratory errors significantly. Under good laboratory practice, laboratories must maintain proper deviation reporting systems and CAPA procedures. Investigation records, personnel training records, documentation, and traceability systems should also be maintained. Effective deviation management supports regularity compliance and laboratory quality systems. Effective error prevention systems provide many benefits. They improve laboratory reliability, strengthen data integrity, reduce operational failures, and enhance safety and compliance. They also improve audit readiness and increase laboratory efficiency. Overall, error prevention strengthens laboratory quality systems. Let us understand a real-world example of a laboratory deviation. Suppose a sample was stored at incorrect temperature conditions. This may lead to sample degradation, incorrect test results, and repeated experiments. Corrective actions would include investigating the root cause, retraining personnel, and improving temperature monitoring system. This example shows how even small deviations can create major laboratory issues. To summarize the session, we discussed laboratory errors and deviations, causes of laboratory mistakes, deviation reporting systems, root cause analysis, CAPA procedures, and error prevention strategies. We also understood the importance of GLP compliance in deviation handling systems. Effective error management improves laboratory quality, safety, and reliability. I hope this session helped you understand the importance of error prevention and deviation handling in laboratories. If you have any questions or doubts, please free to ask them in the comment section. Thank you.